So hemorrhagic stroke is one of the areas which has been a bit more neglected. Not that there hasn't been a lot of work, it's just that it's a slightly less frequent type of stroke, and so people have been concentrating on ischemic stroke. Anyway, in recent years, the attention has focused more on hemorrhagic stroke, realizing that there are different types of hemorrhagic stroke, and addressing questions of, how do you deal with the acute situation when somebody comes to hospital with what is often a very nasty stroke due to hemorrhage? How do you try and get them through that acute phase? What's the best thing to do? Should you give drugs that try and stop the bleeding? And there'll be some new information on that. That's a really important area. And then when you come to secondary prevention, if somebody was on a blood thinning drug at the time they had their hemorrhage, should you restart that blood thinning drug, or is that just going to make their risk of having another hemorrhage even worse? Or actually, will it help stop them having an ischemic event, which is why they were on the anticoagulation or blood thinning drug in the first place? And then there's also questions. Increasingly people are taking anticoagulant drugs in the community because they have a good reason for doing so. But a complication of those drugs is that you might have a hemorrhage. And then if that's the case, should you be given a drug which can reverse the effects of the anticoagulation in the acute phase, or should you not do that? So, all of those are really important clinical questions. They're not the sort of thing that you could answer in experimental studies in the laboratory. There are questions which you have to take into the patient population. So be able to hear about all of those.